Hi, my name is Dan Freedman. I am a pediatric neurologist at Dell Children's Medical Center in the University of Texas Dell Medical School. I'm here today to provide you with some helpful information on the COVID vaccines as we begin to see emergency approval of these vaccines and worldwide rollout in the coming weeks to months. As always, these videos are for educational purposes, so please discuss any personal medical decisions with your medical provider. At the beginning of this pandemic, I knew if a safe and effective vaccine could be developed, that it could not only save countless lives, but it would also help bring an end to the pandemic. I've had a long-standing interest in the history of vaccines, particularly how vaccines have helped eliminate and eradicate diseases. So when I saw the opportunity to be involved in a trial near me, I jumped at the opportunity. I was one of thousands of subjects in the mRNA vaccine trial, and I can tell you that I did experience some minor side effects like muscle aches, chills, and fatigue that all lasted a few hours. As mentioned earlier, the rollout of these vaccines is starting to happen in some countries. Supply will initially be limited as production ramps up, and the vaccines will be rolled out in 3 phases, according to the CDC's Advisory Committee on Immunization Practices. There will be some state-to-state and institution variation, but for the most part, the first phase will be targeting patients that are at highest risk. So that includes healthcare workers, patients with high-risk medical conditions, and people over the age of 65. At this time, we have limited data on the safety and efficacy of these vaccines in children, although we do have some data, and there are currently studies enrolling adolescents, so we will have more information in a few months. Right now, we do know the mRNA vaccines are highly effective in adults, and there are some transient side effects that are common, such as the side effects I experienced: headaches, muscle aches, fever, fatigue, chills, but typically these side effects last for less than a day. Importantly, these side effects do not mean that you have COVID. None of the COVID vaccines can actually give you COVID, the disease. I also want to emphasize the development of these vaccines was expedited but not rushed. All of the vaccines currently under development still had to go through the same regulatory process a normal vaccine would go through. The coronavirus and mRNA research that had been done in decades prior was the framework that they used to quickly adapt this new vaccine to the novel coronavirus. Thanks to Operation Warp Speed, the vaccine developers were also able to cut through a lot of regulatory red tape, which shortened the time it took to develop this vaccine. Tens of thousands of people have already received this vaccine, and it will soon be millions, so you will certainly not be the first person to receive this vaccine. All vaccines are continuously monitored for safety, even after they're distributed. So any rare side effects that develop will be monitored. These vaccines are very promising, and we currently have very good data on the safety and efficacy, and we'll have more information in just a few months. The most important point of all is that it'll take months to get to millions of doses distributed and millions of people immunized. So we need to be extra cautious about following CDC guidance regarding social distancing, mask wearing, and good hand hygiene. For more information on COVID-19, please visit the Child Neurology website. Thank you.